Did you know that 58% of insured adults report problems with their health coverage? That includes claim denials, pre-authorization delays, and provider network issues. These aren't just frustrating, they directly impact patients' access to care and healthcare providers' ability to stay financially healthy. Behind every denied or delayed claim is a billing process that didn't go as planned. In this video, we're talking about one of the most important metrics in revenue cycle management, your clean claim rate. What's a clean claim? Why does it matter? And how does it impact the entire financial health of your medical practice? Let's dive in. In medical billing, a clean claim is a claim that's submitted correctly the first time with no errors, no missing information, and no compliance issues. It's complete, accurate, and meets all of the payer's specific requirements. That means the payer can process and pay it without needing any additional documentation or clarification. Clean claims help providers get reimbursed faster, reduce administrative burden, and maintain a healthy cash flow. Dirty claims, on the other hand, are riddled with errors. They may include inaccurate patient or provider information, incorrect coding, missing documentation, claims submitted past the payer's timeframe, or services listed on a claim that don't match the diagnosis. And all of these issues result in claim rejections or denials, which slow down your revenue and cost your team time and resources. Here's how to spot the difference between a clean and dirty claim. A clean claim has accurate demographics and insurance info, includes proper CPT and ICD-10 coding, has documentation proving medical necessity, meets the payer's formatting and authorization requirements, is submitted on time. Your clean claim rate is the percentage of claims submitted that pass through payer edits and get accepted without error on the first submission. It's calculated by dividing the number of claims that pass all edits by the total number of claims submitted, then multiplying by 100. A high clean claim rate means you're doing things right, submitting accurate claims, reducing rework, and collecting payment faster. A low clean claim rate, that's a sign of inefficiency, process breakdowns, and revenue at risk. Clean claims significantly improve cash flow for healthcare providers, staff efficiency, compliance with payer and regulatory requirements, and overall financial performance. If your clean claim rate is low, your billing team is spending too much time fixing errors, resubmitting claims, and chasing reimbursements. If you'd like to learn more about clean claims, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.